I want to talk about one of my favorite things to talk about, and you might think it's bladder health, but it's not, although it is a very important subject to me, near and dear, mostly because so many people, older, yes, but also younger than you would expect, have issues in my practice. And so I love talking about it because I think it's a quality of life issue, and there are things that we can do to make it better. But what I'm really excited about is that right-hand sort of image on this slide is plant medicine. Being a naturopathic doctor, I think it's really important that we use the least invasive methods to diagnose and treat, and of course do no harm. And I think that in my area, when I stumble upon plant medicines that are extremely effective in what they do, they're safe, and they don't have the devastating side effects of some of the medications that are usually prescribed for the clinical condition that I'm dealing with, that is my go-to. That is basically how I run my practice. And you know, if you've heard me talk before, I think there's value in all systems of medicine. Conventional Western medicine saves lives, pharmaceuticals. My parents were both pharmacists. There's a place for everything, but I got to tell you, when it comes to nature and the body's ability to heal itself and using plant medicine, it's just one of my favorite things to talk about. So I really appreciate your time and joining us. Okay, next slide. So let's just talk about why we're talking about this. It's a big deal. And, you know, I'm going to go through some of these stats here. Bladder issues in the United States. Urinary leakage, 43% of older women, or older Americans, I should say, age 65 or older reported urinary leakage in the United States National Health and Nutrition Examination Survey. I think that it's underreported, to be honest with you. That's what I'm seeing in my practice. When divided by gender, 30% of men and 55% of women. So why? Is it the X chromosome? No, I think it's just how we're built. Our urethra is shorter. There's also other things that can contribute to women having bladder issues more than men, but it is an equal opportunity issue as far as I can see. So incontinence, in a paper published in Reviews in Urology, the prevalence of incontinence in the general population, we have females ranged from 20 to 30% in young adults. Like I said, this is not just a problem in the elderly. 30 to 40% in middle age and 30 to 50% in the elderly. In men, the rate of incontinence is lower than in women, about a 3 to 11% overall. And then one of the things that I think is probably just one of the most frustrating conditions to stumble upon if you have it is overactive bladder. It affects approximately 15% of adults, and this is definitely increasing as we advance in age. And overactive bladder is something that just is frustrating. You know, you feel like you go to the bathroom, you empty your bladder, and then it just feels like you have to go yet again. And this can decrease your quality of life. I've seen it in my practice inhibit folks their day-to-day activities because they're always planning on, hey, where can I get to a bathroom? And it's all consuming. So this is something that's really important to talk about. Okay, next slide. So nocturia is waking during the night. Now, this is important because what is sleep to us? It's everything, right? I always say it's like the best anti-aging medicine that is out there. It is where we rest, relax, and repair. Yes, we can have all the crazy that happens during the day, but where do we get that refuel? Where do we get that that charge? It's through not only getting to sleep, but being able to stay asleep and cycle through those 4 stages of sleep so we get that deep restorative sleep. So, but here we are, and you'll see that as the age goes up, around 40% of older men and women void 2 or more times per night. So getting up once, you know, if you slept for 4 hours, you probably have gotten into a deeper sleep, but 2 or more times, that is going to weigh not only on the inability to sleep and have that restorative sleep, but also you decrease melatonin production if you turn the lights on, right? You increase your risk for cancer and other things. And so sleep is extremely important. And if people are getting up to urinate during the night because of poor bladder capacity, then this is a slippery slope that leads to many other things if it's not effectively dealt with. Okay, next slide. So let's look at some of the contributing factors. So age, I have seen this. You know, it's one of those things, I mean, I am rolling up on 53 years old, and sometimes I look at my arm and I'm like, where did can somebody just tell me where my collagen went? Like, and muscle tone. In general, this decreases as we age. This is sort of a normal finding, but it is, I think, one of the things where I feel like if you don't use it, you're going to lose it quicker. So that's something we can talk about. Pregnancy and vaginal childbirth. I don't want to say the word trauma in this because pregnancy and childbirth is probably one of the most beautiful things I've ever witnessed. But there's a lot going on there for the mom, and especially, you know, around that area there that affects. So this is definitely a contributing factor. Frequent urinary tract infections, autoimmune diseases, diabetes, stroke, systemic infections, those can all be contributing factors. So next slide. So for women, we're looking at stress incontinence or urge incontinence or a blend of both, okay? So in stress incontinence, what you're looking at is sort of a relaxed pelvic floor and increased abdominal pressure. Our buddy, Dr. Jacob Teitelbaum, when he is affectionately talking about this subject, he states that this is a person that I laughed so hard tears ran down my legs. That's definitely his saying there. Overactive bladder, and then of course an infection, cystitis. All right, next slide. So common bladder issues with men, we're having urinary retention, primarily urge incontinence with men, and then also when the prostate becomes enlarged, and it can be benign, meaning it's not prostate cancer, but it's benign prostatic hypertrophy, and that can add pressure and then certainly contribute to men having bladder issues. Next slide. Like I said, it's an equal opportunity issue, different physiology, so we're looking at different contributing factors. So once again, you know, medications. There are many out there that are conventionally used for the treatment of bladder issues. Most of them are anticholinergic drugs. And what they do is they block the action of acetylcholine. And acetylcholine is a chemical messenger. Yes, it prevents abnormal bladder contractions, but acetylcholine is necessary for normal functioning of the body, especially the neurological system. And I think sometimes this is the part where I get a little bit of a stickler around, hey, you know, how are we going to do this without creating more harm? Because next slide, you know, in first do no harm, I take that really seriously. You know, should you have to choose between bladder control and long-term neurological effects? I don't think so, right? So I always say, like, especially if people come into me and, you know, they've gone to their primary care provider and or, you know, sort of the insurance-based model, and they are having bladder issues, they put on a medication like an anticholinergic drug. I'm looking for the exit strategy. I'm looking to identify and treat the cause. I'm looking for something safer with less side effects, because not only does the anticholinergic drugs have an increased risk of dementia with use over 3 or more years. You know, so what is being, you know, the big thing is you have to understand and remember the body has an innate ability to heal itself, right? So anything that shows up clinically, we can always get in there, take a deeper dive, and want to get to the root cause. And so we do want an exit strategy when somebody is on a medication that might cause more harm than good in the long term. And anticholinergic drugs also, I mean, dry mouth, dry eyes, there are some uncomfortable side effects as well. All right, next slide. So let me talk about my favorite subject, plant medicine. It's botanical medicine. It's using what is known as angel's herb. It's one of the native plants that thrives during long hours of summer. sun, which can be 24 hours, in Angelica archangelica in Iceland. So, the thing that I've seen most about nature and natural medicines or plant medicines is that if you just think about it, right, what do we want when we're looking at a stronger bladder capacity or a stronger muscle tone? Something hardy, right? Something that can, like, get in there. And I think nature provides that all the time. There's a balance. There's a meaning. Like, just for example, watermelon is full of water, but if you eat the seeds, although it's hard to find a seed-full watermelon these days because they're all seedless, which drives me crazy, but the seeds are, they're almost more effective than a loop of Henle diuretic. They're such a great diuretic, right? So there's that balance. And if you understand the medicinal properties of walnuts for cognitive health, you look at a walnut inside and it looks like a hemisphere of the brain. And so we see this again with this beautiful herb, Angelica archangelica. It's used in Iceland for over 1,000 years, was so valuable in medieval times that Iceland's first law book specifically banned the theft of it. And so it's not. It's relative of the ginseng plant, and sometimes it's called the ginseng of the north, but it's not at all. I don't want you to get this wrong, related to any sort of ginseng. It's not a ginseng. This is a very, very special herb. So a monk in medieval Europe had a dream where an angel told him that Angelica could be a cure for the plague, and that's why it's known as angel's herb. So beautiful, hardy Angelica archangelica. And so next slide. Traditional uses, this is another thing that I like about plant medicine, because that, opposed to, let's say, pharmaceuticals, is that they usually have multiple targets in the body, and that's why they're so effective for different ailments, so respiratory ailments, the bubonic plague, poisoning, infections, digestive complaints, antidepressants, fever, rash, wounds, menstrual issues, arthritis, traditional uses, because the compounds in plants, for example, like a COX-2 inhibitor that you would find from a pharmaceutical Western approach, does one thing. It inhibits the COX-2 enzyme. When we're looking at plant medicine, this is something that is, it can potentially be so much more effective across the board because it has multiple targets in the body. All right, next slide. For men and women, like I mentioned before, bladder issues, equal opportunity, I believe it's shown in clinical studies to provide support for healthy bladder function. Uniquely, this natural medicine works both for men and women. 1/3 of men and women aged 30 to 70 could benefit from additional bladder support, and I see this in my practice. And I have to tell you, the reason I feel like it's underreported is because when I'll be finishing up with a new patient, it's like the 11th hour, right? We're just about to just sum things up and get started with a plan, and they'll mention it maybe at the last minute because for some reason this is an embarrassing issue for folks, and sometimes people just keep it to themselves. But I don't want that to happen anymore. Come on out because there is something we can do about it. Next slide. All right, so how does this incredible angel herb work? So Archangelica angelica contains many beneficial plant compounds, as I talked about. Isoquercetin, a flavonoid, cholinergic acid, another polyphenol. And quite honestly, I'll go through these slides and I want you to understand the importance of it, but I don't think that we are done figuring out how powerful this medication is. This plant and this medicinal plant is. I don't think we're done understanding how it works and how much it can do. The effect on leukotrienes, which is a compound which triggers smooth muscle contraction, so it inhibits leukotriene activity by stopping it binding to the receptors. Okay, so leukotrienes are active in the lungs, the arteries, and of course the bladder. Big thing here: no adverse side effects on libido or testosterone levels. Next slide. So let's, one of the things that, first of all, I love doing these type of webinars is because, and of course, plant medicine, we can get down to the evidence. we can get down to the dosages and the efficacy because the plant has been clinically studied. So let's explore this a little bit. Next slide. So this is a clinical trial using Angelica for bladder support. It was an eight-week study to 69 men, all right? So remember, but we're looking at mechanisms of action, and the study was done on men. I use this herb all the time in my practice for both men and women. These men had that awakening during the night, and they either received the Angelica or a placebo. Here were the results. It increased bladder volume by 44 milliliters. Now, if you increase your bladder volume, you can hold more, right? And so potentially not having to get up so much in the middle of the night to void. Reduction in nighttime bathroom trips. This is a great piece of the study. For those who are making at least 3 bathroom trips per night at the study start, 1.4 fewer bathroom trips. That's up to a 50% reduction. So that, to me, increases sleep, increases quality of life, reduces the risk for other issues as we grow older. And then also increased duration of first sleep, all right, so that's the time before awakening to use the bathroom, which is if you can get that 3 to 4 hours in, it's awesome because then you can cycle through those important phases of sleep. And in the oldest participants by 101 minutes, that's almost triple the time of sleep you need to void. So excellent results here from this clinical study. Let's go to the next slide. So also reduction in nocturnal voids, how many times you get up to actually go to the bathroom. For a subgroup was reduced nocturnal bladder capacity and excluding those with sleep disorders. So this was not folks that were having a hard time sleeping anyway. Low nocturnal bladder capacity is directly related to urinary frequency, and the index indicates reduced bladder volume at night. A higher index indicates less nocturnal bladder. So the Angelica group experienced a significant reduction in voiding frequency and the NBC index, which is that, basically nocturnal bladder capacity. So really powerful results here. Then we've got an increase in average bladder volume. So an average nocturnal bladder volume per nocturnal void for a subgroup with less than 260 milliliters of volume. The Angelica group experienced an increase in bladder volume of 44.3 milliliters, which is 17% increase over their initial bladder volume. So low bladder volume is directly related to urinary frequency. So if we grow that bladder volume, that capacity, we get better bladder control and we get a better night's sleep. So significant increase in bladder volume here. Next slide. So increase in smallest bladder volume. So increase in smallest nocturnal bladder volume per nocturnal void for a subgroup with less than 260 milliliters bladder volume initially. The Angelica group experienced an increase in bladder volume of 66 milliliters. This is a 25% increase over their initial bladder volume. And so, once again, extremely significant. And then we have here reduction in nocturnal voids per hour. For a subgroup of people with more than 3 voids, all right, during a standardized 8.7-hour night, for the standard night sleep, this translates to decrease of 1.5 trips to the bathroom. That's huge. That is huge. So another very significant decrease in voiding. That means what are you doing? If you're not getting up and go to the bathroom, turning on the light, decreasing your melatonin, you are sleeping and you are healing. And that is what is so exciting to me about this herb. All right. That first initial sleep period, once again, if you can get it in and you can sleep, there you go, right? So we've got, for the subgroup of people 70 years or older, and excluding those with sleep disorders, the first sleep period at night is generally regarded as the most important one. I've seen this, I know this. And the Angelica group interrupted first sleep period increased by an average of 101 minutes. I'll take that sleep any day. So very significant finding here. So here's the summary. It's safe and well tolerated. So first, do no harm, right? Use the least invasive methods to diagnose and treat. If you've got something that's safe, natural, and effective, let's go for it, especially with such a persistent equal opportunity issue as bladder issues. So Angelica significantly reduced nocturnal voids and significantly increases nocturnal bladder capacity. Also increases average nocturnal voided volume and smallest nocturnal void volume as well. And as well, it increased the duration of first sleep period to the oldest group, which is so extremely important. Cannot emphasize that one enough. All right, moving on. So let's talk about this. I love this slide, the side benefits, okay? And once again, I talked about this plant and I thought, you know, yes, we know that it contains a couple incredible compounds, but I think there's so much more going on that we don't know about, because the side benefits instead of side effects, we're looking at cancer, anxiety, and the immune system. So the angelica fruit contains a chemical that inhibits proliferation of cancer cells in tissue cultures, okay, both colon, breast, and pancreatic cancer. We're seeing that. So it's anti-proliferative, meaning, you know, that's when cells grow and proliferate. There's more of them, so decreasing the risk of cancer. Angelica seeds show 2 chemotypes of essential oils. The essential oils inhibit proliferation of cancer cells, and the leaves, and that's another thing why I love to talk about plant medicine, because there's different parts. There's the fruit, there's the seeds, there's the leaves, there's the stem, and this is what makes it so, I think, synergistically comprehensive when we look at applications. So the leaves contain a chemical that arrests tumor growth. So they're looking at this more and more for the treatment and prevention of cancer. Anxiety. I know you're like, bladder cancer, anxiety, but this is the beauty of botanical or plant medicine. So compounds extracted from angelica were shown to have significant anxiety-reducing activity. This was in an animal model, but once again, I think that we're continuing on with these studies just to see how powerful this angel herb is. Antiviral. So an extract of whole fruit, and 5 of the isolated compounds from the fruit were shown to have antiviral effects. The whole fruit extract had the strongest inhibition of herpes simplex virus and also the Coxsackie virus. So according to the World Health Organization, over 3.7 billion people, a lot of them, less than 50 in the world are infected by the herpes simplex virus. And so we're looking at the immune system and having antiviral capacity with this herb as well. Next slide. So I think I saw a comment come up because I know this WebEx has changed the format, but I do think I saw, is this the same as Dong Quai? It's not, not at all. I know it could be misunderstood just because of how similar the names are. Angelica sinensis is Dong Quai. It's indigenous to China, most commonly recommended for transition into our lovely natural phase of menopause, for PMS, menstruation, low energy. And then we've got our angel herb, the Archangelica angelica, or the Angelica archangelica, I should say, indigenous to Scandinavia, Greenland, Iceland, and mostly right now at this point in time recommended for bladder concerns. So great question if you asked it, and here's the answer. They are not the same. They've got different properties. They come from different places. They do different things in our bodies. So also, you know, we hear a lot about saw palmetto, which is a great herb. It is indigenous to the United States. It's most commonly recommended for that benign prostatic hypertrophy and other prostate concerns because it inhibits testosterone's effect on prostate cells by inhibiting testosterone being converted to DHT. And so once again, much different saw palmetto in the way that the mechanism of action is being used than the Angelica archangelica. All right, next slide. So as I mentioned before, we all can benefit from it. Overactive bladder, nocturia, BPH, that's just for men. Stress incontinence, that's my Jacob Teitelbaum. I laughed so hard, tears ran down my legs, and a variety of bladder issues because we're looking at a mechanism of action that is wonderful for the smooth muscle contraction of the bladder and so on and so forth. So let's go to that. Next slide. How to use it. So my recommendation, 200 milligrams to start for the first 2 or 3 days. Then you can reduce it to 100 milligrams. Now, if you see improvement and then a decrease in improvement when you do reduce it, you can stay at that 200 milligrams very safely if desired. For stress incontinence and daytime bladder problems, I recommend you take it in the morning. For nighttime, take it before bed. And once again, through all of these studies and for the uses that I've seen for the past decade, no significant adverse side effects. So we're looking at safe, bold, here, effective, right, natural medicines. Now, what we're looking at, too, for other maybe supportive supplements, because we're looking at that, wanting to look at the neurological, properties of the bladder, the musculature, those triggers of inflammation. So it's really important to consider as well omega-3 fatty acids, anti-inflammatory in nature. Magnesium may help decrease the frequency of bladder spasms, and vitamin D, making sure that you recover vitamin D levels. I like to see it between 60 and 80. There's too many times I have women and men, to tell you the truth at this point in time, come into my office, their labs in hand, right? And everything is like, within normal limits. So, but let's look at it this way. If you've got a vitamin D level and the reference range is, let's say, 24 to 100, and nothing is flagged on your labs because you've got a vitamin D level of 25, so you're quote unquote within normal limits. Well, to me, it's one click above rickets, and it's not optimal. So vitamin D, when we're looking at bladder health, we're looking at bone and muscle strength. And so recovering those vitamin D levels to appropriate and optimal levels is the way that we need to go. Diet and lifestyle, obviously, as a naturopathic doctor, very important to me. Don't use it, you're going to lose it. So using those muscles, pelvic floor muscle exercises, Kegel exercises, very, very important. They're one of those things is kind of like doing eye exercises. I can go to the gym and, push against resistance with weights and see immediate results. Now, this eye exercises for myopia or these type of exercises, this is consistency over intensity. This pays off hugely with this issue, but you got to stick to it. I've seen it work, and it's by far the least invasive, right? But having those exercises on a daily basis, several times a day, getting those muscles circulated with nutrients and blood flow, extremely important and helps contribute to the resolution of these bladder issues. The triggers, coffee, even decaf, spicy foods, carbonated drinks, alcohol, chocolate, some acidic fruits, everybody's different, but really important to avoid these triggering foods that can overexcite the bladder. Smoking definitely can irritate the bladder. Being able to stop drinking water or anything 2 to 3 hours before bedtime can be helpful. Getting to an ideal weight so there's less pressure on the bladder, that's where pregnancy comes in, where there's a lot of pressure on the bladder. Using a pessary or acupuncture. I refer to acupuncturists all the time. Wonderful modality, has been seen to be very helpful in folks with bladder issues as well. So just some supportive things that you can do diet and lifestyle-wise. All right, so I think we're coming to the question portion. I don't know if I can see these questions, but I'm going to try.
Well,
okay.
I can read those to you. So thank you so much, Dr. Lucille, for this wonderful presentation on a problem that is not life-threatening, but certainly threatens our quality of life. And we already have a couple of questions in the box. One says, I'm a woman in my 50s. I wake up a lot at night because of hot flashes, and then I have to go to the bathroom. Will this help me get some sleep even if I'm having hot flashes?
Well, it's a great question, but if we look at the mechanism of action, I think that this is going to help you sleep, decreasing the amount of times you wake up to void. But if you're being initially woken up by hot flashes, we got to get some support on board for that. So those night sweats are important, and there's really, easy things that you can do for them. Everybody is different, but The question, I guess I'm going to answer the question is no, because that's another sort of stimulation that's waking you up, and it's twofold then. We've got to get you support for the night sweats and also support then for having to void during your sleep.
Another question is, I've heard of this problem before. Why can I hold my bladder even though I have to go? But when they're almost to the bathroom or they think they're almost able to go, they start to lose control. So they make it like to the bathroom door and then start to lose control. Is there a mental connection? And also, can you talk about the hormonal connection to bladder as well?
Yeah, so, you know, once again, I hear what you're saying. It's a great question. I think there is a mental, I've been in this position myself where you can hold it, but the closer that you get to the bathroom, it's almost like the worse that it is. And if you can like just take a diving leap and land on the toilet, you're going to be fine. So I think that there is certainly something where it's like, okay, I know that I'm just going to be, soon able to release, right, this pressure. And so I do think that there is a little bit of that going on. And from a hormonal perspective, estrogen does play a role in the smooth muscle intensity of anything, our uterus certainly, our bladder. And so that is a component that I think we could also talk about. And it's just a slice of the puzzle, though, or a slice of the pie, because as we grow older, our hormones, our steroidal hormones, I should say, both men and women decrease naturally with age as we go into menopause, andropause. And so I don't want to look at it as an estrogen deficiency, right, because these are normal hormonal transitions for both men and women. And still, with those normal transitions, we're not looking to have these weak bladder issues. So I go back to, okay, what's causing that? And then the other things like ruling out food sensitivities, making sure that you're doing your Kegel exercises, and then if needed, an incredible herb like Archangelica angelica just to increase that bladder tone.
Excellent. Thank you. I'm just going to go through and make sure I haven't missed any of our questions today. One other question, is there any connection between the use of Archangelica and occasional bladder incontinence issues and fibroids in the uterus?
No, I would have to say no. So fibroids in the uterus, basically we're looking at, fibroids are sort of an outpouching of the uterine wall. So you could call them anything. It's not like they're just kind of floating around and they get stuck to the uterus. This is an outpouching. And if you think about uterine tissue is influenced by our hormonal cycles, estrogen and progesterone. Estrogen is the hormone that tells cells to grow and proliferate. And so, and it's very important, right, because it's so strong it initiates puberty in a young girl. Now, unfortunately, happening 2 years earlier than it was 20 years ago or so. Also, it gets it's dominant in that first half of the cycle, so it's getting the uterine lining all plumped up for implantation. So very appropriate uses of this very powerful hormone that tells cells to grow and proliferate. Now, if it's imbalanced with progesterone, or if we're getting other stimulation like xenoestrogens or estrogens in the environment, which there are a lot, plastics and pesticides and car exhaust and soaps and emulsifiers, household cleaning products, health and beauty aids, like you name it, that's when the stimulation can be too strong, and that's when I think we have issues like uterine fibroids, and so a little bit different here.
Another one of our attendees is asking about mixed incontinence. She's been told she has mixed incontinence, and can this help with all kinds of incontinence?
Yes, this will be the angel herb for you. This is something that you need to try. Get on that dose and stay on it, but with the stress incontinence, the urge incontinence, the mixed incontinence, doing those other lifestyle things, check your vitamin D, essential fatty acids, the exercises, etc., but this will help immensely.
So here's another question. How long does it take the Angelica to work?
I have seen in my practice, now this is not a condition that I have myself, but the reports are fairly quickly, and that's why the dosage at starting at 200, you can decrease to 100, but you can stay at that 200 if needed. So within 2 to 3 nights, you're going to be able to see a big difference.
Mm-hmm. And I think that in some of the studies, they went on for like 8 weeks, and so if you should start to see improvement probably, but continued improvements might be expected.
Absolutely. And that's why I said with all of these things, what's really important, and I think this is a great point that you make, Cheryl, is that it's, you know, I said before, consistency over intensity, and sometimes this is the key with plant medicine. It's not a here, take this approach when we're looking at like a medication. Mm-hmm. We do have to have patience sometimes, and you have to stick with it and stay on it.
All right. How about just juicing the Angelica plant? Won't this give you the full benefit?
Nope.
Well, I'm just thinking, you know, I'm not sure how much of the Icelandic, because they're different phenotypes, right? This is Icelandic Angelica, correct?
That's a great point. That's a great point. So, no, this is a very specific Angelica coming from Iceland that is used in these studies, and so. Yeah, that's the thing that I think, so the answer to the question absolutely is no. I don't think we're going to be able to get the benefit. And then once again, I'm a big advocate of using your beverage as your medicine. I really am. So any teas throughout the day, there's, of course, all these herbs can be infused with water and you can make into a tea, but we're looking at kind of dose dependence, right? So I talk about this quite a bit. We want those dosages that were perhaps used in the clinical studies and that have been proven to be effective, because a lot of times plant medicines, they're dose dependent, and so it's important to realize that.
Mm-hmm. Leading right into, is there a difference with your weight? Is there a difference between larger men versus smaller women? It's sort of, it's kind of individualized, isn't it?
Yeah, it's a great question, but no, that dosage recommendation from me, it's across the board for me and my patients.
Mm-hmm. Here's another wanting to know if the essential oil is the same thing.
Nope. So the essential oils you can definitely utilize, and of course those essential oils have been starting to, you know, we're understanding different properties, but it's not the same thing as this particular herb. Right.
And the same thing, I have another individual says they're currently taking a dropper full of Angelica. Is the liquid better than the tablets or capsules? First, I'm not aware of a liquid Icelandic Angelica, Archangelica available in the United States.
And Cheryl, you keep bringing up that great point, which you've got to look at this as it's the, and I'm sorry if I didn't emphasize it enough during our webinar, it's that this Icelandic Angelica that we're talking about that's being used for bladder control. So great questions, folks, but I'm going to keep pointing you back to this one.
And also a question, if you don't mind, I'll take it because I have some experience with this in patients. What is a pessary? A pessary is a supportive device for women who have what they call prolapsed uterus. And prolapsed uterus can put a lot of strain on the bladder. That's where the uterus is not properly supported where it's supposed to be. And a pessary is just like a diaphragm-like device that's inserted into the vagina to support the uterus from within. It's a little bit more old-fashioned. It's still being used, but nowadays more people are opting for having a surgical procedure to help support a uterus that's losing some of its musculature. All right, let's see if there's other questions. How about any success with interstitial cystitis?
With this Archangelica herb?
Yes. Yeah,
so, you know, we're looking at the cause of the bladder issues, right? So I think what's really important, if there is a chronic infection, we need to clear that up. And a lot of times we look at going even deeper systemically into your microbiome. You know, I have seen this throughout the years where the bladder wall is almost, the bladder sort of wall is almost like the intestinal wall, right? So we've heard of leaky gut. Guess what? I think we kind of have a leaky bladder sometimes. And I don't mean leaky as in urinary leakage. I mean that there are components, there are bacteria, viruses, fungal things as well that perhaps are out of balance with our good bacteria. And this can contribute to more and increased urinary tract infections, bladder infections. And so we look at that more systemically. I think that's extremely important. This has been helpful for the side effect or the result of interstitial cystitis, inflammation, right? So the itis is the inflammation part, so we're helping decrease that, but also we want to get to the root cause here and clear up the infection at all, understanding why the inflammation is there, making sure that those inflammatory things that we talked about, vitamin D, essential fatty acids, and avoiding those triggering foods, very, very important in that situation.
Excellent. I'm just going through here to make sure that we didn't miss any. Oh, an individual would like to have a list of acupuncturists in the area where she lives that would be legitimate, et cetera. Why don't you contact us through our Terry Talks Nutrition page, and we'll show that in just a moment, and we'll see if we can't investigate your area through perhaps a local affiliation and get you a list of acupuncturists in your area.
Perfect.
All right, let's see. I think we've covered them all now, Dr. Lucille. Thank you.
All right, so I just want to recap. Listen, as I said, my favorite subject kind of to talk about is plant medicine because it's so powerful. Use the least invasive methods to diagnose and treat. You can do it effectively. I want to emphasize that. But at the same time, we can do it safely. Lifestyle interventions, dietary interventions are always really helpful and important to grease the skids for success in no matter what we're doing, because the last thing you want to do is get on a medication, here, take this approach, and then the back of the hand, like, okay, that's all I got to do. That's my health care. We got to put more into it. So lots of fun things that we can do to decrease contributing factors, but also get the job done, increase our sleep, increase our restoration, increase our quality of life, and decrease our risk for further diseases as we age.
Thank you, Dr. Lucille. That's just an amazing recap, and thank you for all this information on a very important issue. We hope that you will come back and join us again on another topic in natural medicine very soon. Folks,
one of my favorite things to do.
I love it. Thank you so much. Folks, you can find Dr. Holly Lucille at drhollylucille.com.